Yeah, no, happy to talk about it. Yeah, we're very excited about the liquid biopsy approval as well. Now I feel that we have a portfolio of both tissue and blood that's both FDA approved, similar genes, ability to measure kind of TMB in the blood and MSI. So, we really kind of have an apples to apples in some way with just different inputs. And so that, I think each step along the way, there's lots of questions to think about, especially for rare cancers. When you get tissue as kind of the gold standard of histopathologic diagnosis. Is blood giving the same information as genomics in every case? What kinds of tumors are DNA shedders into the blood, for example? Are they putting DNA into the blood that we can measure? If we can measure it, does that give some prognostic information? Does it say you're maybe more likely to recur sooner if there's a lot of DNA in the blood or not a lot of DNA in the blood? Um, you know, at, re- at recurrence, by imaging or otherwise, can we pick that up with the DNA before the imaging? After the imaging, if we've seen something progress, can we interrogate those DNA changes again and say, like, can we understand why it's not responding to this drug anymore? Both to find new targets for therapies and to make decisions about what the next therapy is. So, I think the ability to kind of get this information from the blood makes it, hopefully easier in the future to monitor kind of changes over time, whereas, invasive biopsies are obviously harder to do. And so, to Dr. Kurzrock and Dr. Groisberg's point before, the information that people are getting back is just becoming more and more complicated. Even with genomic profiling in general, in the beginning, as Dr. Kurzrock mentioned, knowing what kinds of alterations there were present in the DNA led to potentially responsive to different kinds of therapies. That's kind of one aspect of it. But now we're saying, well, we're going to look at DNA in the blood, and there are different levels of DNA in the blood. How do you put that into your decision making? How do you put any changes that you see in the DNA in the blood into your decision making? So the decisions are just becoming more and more complicated as we generate more and more information. And so being able to kind of like see how this information is used to make decisions, and then what the outcomes are based on all these kind of things with really great collaborators is really exciting for us.